Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of general medicine with the topic emergency medicine basics, and the subtopic will be shock. So let's start.
Welcome to the medical examination. Today let's discuss shock. To begin, could you please define shock in terms of pathophysiology?
Yes, there are three main pathophysiology. Reduced perfusion due to decreased cardiac output or reduced systemic vascular resistance. It leads to low blood pressure and poor tissue oxygenation. Then second is anaerobic metabolism, where cells switch to anaerobic metabolism causing lactic acid buildup, which causes lactic acidosis. And then cellular dysfunction due to impaired energy production leads to cellular damage, inflammatory cascades, and eventual apoptosis.
That's a comprehensive explanation. Now, can you classify shock into the main clinical types? Please note that this information is not medical advice or a diagnosis. You must see a healthcare professional for any personal health concerns or to seek care.
The classification of shock according to clinical types would be hypovolemic shock, distributive shock, which has septic shock, anaphylactic shock, and neurogenic shock. Then third is cardiogenic shock, and fourth is obstructive shock.
Excellent. Now imagine you are presented with a patient who has low blood pressure, a high fever, and altered sensorium. What would be your initial stabilization steps?
The initial stabilization step starts with general management, airway, breathing, circulation, monitoring mean arterial pressure and lactate levels, and then administering crystalloids, NS, and we can give vasopressors in case of distributive shock, or inotropic agents in case of cardiogenic shock.
Those are important steps. Regarding fluid resuscitation, what specific volume of crystalloids would you consider initially for a suspected septic shock patient? And what would be your target for mean arterial pressure?
I don't know, can you explain?
In initial fluid resuscitation for septic shock, we typically begin with rapid administration of about 30 ml per kg of isotonic crystalloids. The goal is often to achieve a mean arterial pressure of at least 65 millimeters mmHg. Now, considering the fever, what would be your diagnostic priorities to identify the potential source of infection?
I don't know.
We should prioritize obtaining blood cultures before starting antibiotics, as well as cultures from potential sources like urine, sputum, or any specific site of infection. Broad-spectrum antibiotics should then be initiated promptly. Are you familiar with the concept of empiric antibiotic therapy?
Yes. Empiric antimicrobial therapy is the immediate initiation of broad-spectrum antibiotics or antifungals based on clinical suspicion, patient risk factors, and local resistance patterns before identifying the specific pathogen.
That's correct. The choice depends on those factors you mentioned. Now, considering the possibility of tropical infections causing fever, how might you prioritize diagnostic tests for conditions like malaria